After knee replacement, everyone wants to know the same thing. How much motion do I actually need? But here's the truth. The answer isn't just one number. It's several critical numbers that control what you can and can't do every single day. Hit these targets and your independence comes back, but miss them and simple activities become real struggles. Let me show you exactly what studies say about the motion numbers you need to know. Hi, I'm Dr. George Bounajem, Dr. B for short, and I'm a Harvard-trained, board-certified orthopedic surgeon who specializes in hip and knee replacements. I've guided thousands of patients through knee replacement, and one of the most common questions I get is, how many degrees of motion do I actually need to get back to my life? Today, I'll give you the specific numbers and show you exactly what they mean for your daily activities. Let's get right into the foundational number for knee function. It isn't 120, it isn't even 90, it's 0. 0 degrees, or full extension, means that your knee can get fully straight. This is the goal most knee replacement patients should aim for. A fully straight knee allows the knee to lock out in a stable position, which means that the quadriceps muscle in front of the thigh doesn't have to work so hard for you to stay upright. But when you can't get at least close to fully straight, the knee can no longer lock out in a stable position. Staying upright requires extra work from the quadriceps to prevent your knee from bending under the stress of your weight. Studies show that losing more than 5 degrees of extension leads to more fatigue and alters normal walking patterns. If you lose more than 10 to 15 degrees, this is where function really suffers. You're fighting your knee with every step because you're walking with your knee perpetually bent. You can even lose the normal heel strike pattern of walking, meaning you resort to walking flat-footed or on your toes, and the energy demands of basic mobility skyrocket even further. Here's the hard truth. Even if you can bend your knee to 130 degrees, lacking extension leads to mobility problems. Extension is crucial for all basic forms of mobility, truly making it the foundation of your knee's function. Now, I need to be clear. Patients who get within 5 degrees of fully straight generally have enough extension to function well, but surgeons typically advise patients to aim for fully straight if possible. So, the first motion number that knee replacement patients should know? It's 0. Now, if extension is your foundation, flexion is your freedom. And there are 4 key flexion numbers that determine if you can walk without compensating, climb stairs, or even put your socks and shoes on. Let's start at the low end. If you're below 60 degrees of flexion, you face significant functional limitations. Even walking on level ground becomes difficult because your knee can't bend enough during swing phase to lift your foot properly. You have to compensate by hiking your hip upward or swinging your leg outward, and stairs become even more challenging. Now, the good news is that reaching less than 60 degrees is quite rare. Beyond 60 degrees, 90 becomes the next critical target. This is the range where many recovery battles happen. If you're between 60 and 90 degrees, getting around is still challenging. You can likely walk on level ground pretty well, but stairs are still a real obstacle. Going up or down stairs comfortably requires 90 to 100 degrees of bend. If you can't reach 90, you're likely forced into doing stairs one step at a time, putting both feet on each step rather than the usual step-over-step pattern. Every staircase becomes a slow, deliberate obstacle. Chairs are another challenge. To sit down and stand back up, you usually need about 90 to 100 degrees of flexion. Lower chairs, or soft cushions that sink toward the floor, require even more motion. If you can't reach 90, you likely rely heavily on your arms to push yourself up from the armrests, or you need a higher seat. And when you are sitting, being unable to bend to 90 degrees leads to your legs sticking out in front of you because you can't pull your foot back. Overall, even just basic sitting can be frustrating in this range. Putting on socks and shoes is also a challenge. Under 90 degrees, you may not be able to bend your knee enough to bring your foot into reach. Putting socks and shoes on may require a sock aid, a long shoehorn, or a step to elevate your foot on. And here's another activity that surprises many patients. Driving. Working the pedals doesn't require much flexion, usually between 40 and 80 degrees. But getting into and out of the car? That's the real barrier. Standard sedans require about 110 degrees of flexion to get into and out of, and even taller vehicles like SUVs still need about 90 degrees. If you're below 90, getting in and out of vehicles becomes an awkward and sometimes painful process. Now, here's what's important to understand. In this range, gaining even 5 to 10 degrees can make a massive difference. 90 degrees is a milestone because of the many activities that hinge on this number. So the 60 to 90 degree range is largely challenging territory. But around 110 degrees, something shifts. Activities stop being obstacles and start being routine. To begin with, stairs become much more manageable. You can usually do step-over-step stair climbing without needing to place both feet on each step. Descending stairs also becomes smoother and more controlled. Chairs also become much easier. You can usually rise from a standard height chair without using your arms, as long as your quadriceps muscles are strong enough. Now, if you're sitting in a low couch or a deep recliner, you might need more motion because those sit lower. But for typical dining or office chairs, 110 degrees is usually plenty. Putting socks and shoes on also becomes much simpler. You can typically reach your foot in this range, and no longer need to use workarounds like a sock aid or a step in front of you. And finally, getting in and out of cars becomes much more manageable at this level. What was an awkward, sometimes painful process in the lower ranges now becomes a relatively normal movement for most vehicles. You're not fighting your knee anymore. At 110 degrees, you can perform virtually all standard daily activities, but reaching 120 degrees unlocks your knee in a way that is crucial for some people's lifestyles. For example, activities on the floor or ground often benefit greatly from deep knee flexion. Kneeling for gardening or prayer, squatting down to play with your grandkids or pick up low objects, sitting with your legs crossed, and getting up from the floor are all significantly easier if your knee bends more than 120 degrees. Now, for some cultures and communities, particularly in Asia and the Middle East, these floor-based activities aren't optional extras. They're crucial for daily life. If that describes your situation, then reaching 120 degrees and beyond becomes much more important. That said, research shows that gains beyond 120 show diminishing returns compared to gains that lead up to 120. Going from 90 to 110 opens up most daily activities, but going from 115 to 135, that enables specific activities that matter to some patients, but you usually won't see major changes in daily activities or independence. So here's the bottom line. Motion beyond 120 matters differently to different people. For some, it's valuable, but not critical. For others, it's essential for daily life. The needs of one person don't always match the needs of another. And that leads me to my final crucial point about this topic. Range of motion is one measure of success after knee replacement, but it's not the only one. Progress matters more than absolute numbers. For example, if you went from 70 degrees before surgery to 100 degrees after surgery, that's real improvement, even if you didn't hit 120. And we can even back away from motion entirely. If your pain has improved, if you're sleeping better, and if you can once again do the things you love, those wins matter tremendously. The goals we've discussed today come from research on large groups of patients. They're useful for understanding what's possible and for guiding your rehabilitation. And generally speaking, we surgeons encourage patients to maximize as much motion as they can, just to make sure that they don't run into any serious limitations. After all, it's usually better to have more motion than you need than not enough. But your motion numbers are not a grade on your individual recovery. Your motion depends on many factors that are outside your control. Sure, your participation in physical therapy plays a huge role, but there are other individual factors and even surgical factors that also matter. My next video will cover everything you need to know about what contributes to your motion in much greater detail. The bottom line is, your knee's motion is important, but it's just one part of the equation. Do your best to control the factors you can, and your surgical team will guide you through the rest. So let's recap the motion numbers you need to know. First, full extension, or at least getting close to 0 degrees, is the foundation that everything else builds on. Below 60 degrees of flexion, you face significant limitations even with basic walking. At 90, you can manage basic activities, but may struggle with stairs, chairs, cars, and getting dressed. By 110, most standard daily activities become easily manageable. Beyond 120, you're gaining motion for activities that matter significantly to some patients, but aren't required in daily life for others. If you're about to have knee replacement, or you're recovering from it right now, here's my video on 8 simple knee exercises that help maximize your knee's motion. If you want more information on why the first 6 weeks are so important, how to measure your progress, and other strategies to help improve your motion, this other video covers it all. If you found this helpful, please click the like button. It helps other patients find this information when they need it most. Stay well, and I'll see you in the next video.